would like to begin by introducing myself. My name is Barbara Bodson, and I'm the Executive Director of LifePath. And it is my honor to be moderating this event today. Thank you all for joining us. And as you just heard, the event is being recorded. Please feel free to enter your name and affiliation and any comments that you wish to in the chat. And Diane Roby, our Director of Client Services, will be monitoring the chat box throughout the event and periodically reporting out on the comments. So as I indicated, we're expecting about 80 participants today and a wonderful cross-section of representation, inclusive of healthcare professionals, hospitals, home and community-based providers, sister aging service access points, mass home care, AARP, the Executive Office of Elder Affairs, Franklin County Council of Governments, Select Board members, Councils on Aging, the District Attorney's Office, LifePath Board of Directors and staff, and a wonderful showing of our legislators. So as I indicated, our time is limited to an hour, and we have much to share with you today. I'd like to begin by acknowledging and celebrating the frontline workforce who provide the in-home care and the unpaid caregivers caring for their loved ones, and all those who support older adults and individuals with disabilities who receive long-term care services both in their homes as well as in nursing facilities. I'd also like to acknowledge the courage, the inner resources, the pride, and the determination of the consumers to maintain their independence and dignity despite whatever challenges they might face. And lastly, I would like to acknowledge our legislators for their steadfast support of home and community-based initiatives. Never before have we seen this level of funding and attention towards the need to reimagine long-term care support services. So, see, we're only at 48, but we're going to kick off our event by showing a video titled Reimagining Care, a LifePath Call to Action, which gives voice to the challenges faced by both workers and consumers alike. It encapsulates the story and the glory of the relationships between direct care staff and consumers.
You know, if we're lucky, we're all going to get old. And when asked, most people want to get old in their homes.
It provides a sense of continuity, of self, belonging in the community. And those things are hard to maintain when you're in a facility.
And to stay in our homes when we're old is really hard. We've never lived independently as older people. We've always lived in communities, and we need to provide care that enables us to live the life that we want to live, even as we age, even with complex medical illness.
One of the biggest barriers we've seen recently assisting elders age in place is getting consistent care through the various vendors that we contract with. We've had people staying in nursing facilities much longer than they would just because we're unable to find that coverage, find that care at home.
That has led to a number of people being sort of stuck where they are, not being able to locate the supports that they would need. And that has particularly gotten worse as a result of the pandemic. I think what we're seeing is a lot of anxiety, a lot of depression, and a lot of feeling like a great deal of their lives are out of their control.
We are experiencing a critical shortage of direct care workers right now, and that's primarily, I think, due to COVID. They're exhausted and traumatized from what they've been through.
It has to do with older people who are maybe considering retirement, exiting the workforce, or not wanting to work because their fears of COVID, and also competition with other places that have raised their wages. We're having people move on to things like Amazon, Target, and those are becoming our direct competitors.
However, we've been experiencing this shortage really for decades. I think we have a long way to go in readjusting our values to put elders in the place they should be and caregivers in the place they should be.
My name is Constance Burnington, and I'll be 96 and I don't feel it. I've got poor bones, and I'd fallen, so I fractured this femur, right across. So I was at Shawnee Manor, and I could come home in May, and I just got home the last week of October. Those things are hard to go when you're feeling, I want to go home. Not to say anything against the girls there. I liked all of the girls. Home is home. I mean, you got your own stuff. You're more able to do things for yourself.
My goal is to help people to stay in their homes. I want to be involved in home caregiving because I think home is better than being in the facility. Even before the pandemic, it was tough. A lot of the aides had to work for 2 or 3 agencies to make ends meet, and they still was living in poverty.
A home care aide, for example, could be a home care aide for 25 years, but really on par with someone who just started today. And they're lucky if they're making $16 an hour. There's no career ladder or even a career lattice.
We're seeing a lot of aides that are working 60, 70, 80 hours, or they're working multiple jobs, partly because they have to because of the low wage, but also because they're in such high demand that they feel almost a pressure to do so.
Before the pandemic, we weren't essential workers. We were just aides, and we weren't really recognized. But now that the pandemic came in, they call us essential workers. Care is essential. We are here to do it, and we need to have our voices heard. For a long time, we have been invisible.
They are the eyes and the ears, and we many times write them off. We're not treating them how maybe we would treat the nurse, and they're such an integral part.
They're the front line. They're the folks most close to the resident or the client, and they generally care a great deal. They need to feel like what they're seeing, what they're saying is being heard and addressed.
There are some days that nobody comes in, nobody calls, those happen. When they come in the door, they take a good look to see that I'm all right first, which is necessary. And I know I can't survive safely here without help. You get to the point where you know what you can do and what you can't do, much to your great surprise. Just turned 80 in August. It's good to be home. I mean, you're around your own surroundings. I watch the birds outside. I like to knit. I like to read. There have been times when they can't come, and that makes it difficult, and things just pile up.
Because the turnover is so high, the folks that stay are always asked to do more.
We don't really have a backup of workers like we used to, and we'll get a call that they're just unable to come. Something happened, life happens, their car breaks down. For someone who's very fragile, we will advise that they go to a hospital or they call 911 to get the assistance that they need or that care, which is something we never would have done before.
I think if we continue on this track of a workforce crisis and we don't solve it, it's going to be a disaster.
People are not getting care, and so they're either not able to be discharged from skilled nursing to come home, or their family is having to pick up the slack or maybe work from home.
And I think largely working women are going to come out of the workforce because they're going to need to take care of aging parents. I think our care is going to decline in terms of our quality of care, and it's not going to be as skillful because we're not training people to go into this work. There's a whole bunch of evidence saying that we need better pay and better benefits and better sick pay, and I think that's really true. But I also think there's a lot that we need in job stability. So imagine a world where we didn't just have personal care aides, but we trained people and they were developing multiple skill sets at the same time. They could be a part of a community rather than this siloed piece, the way we think about it now.
I would like to see care settings that more closely resemble the small home model where you serve a smaller amount of individuals in a more home-like setting.
We've seen through pilot programs that it works really well when you give the direct care worker some autonomy and some regard and some opportunity to be part of the team, that it does reduce the turnover and it does improve the quality of care.
How do we make jobs that people want to work in? Team care for complex illness is really the gold standard. How do we bring people into teams? How do we use their expertise to make our care better? So LifePath has been a really great innovator and leader in trying to think during this crisis creatively about how to create a workforce.
I think until we make this a public campaign, we're not getting that out to the general public that there's this crisis until it affects their life. And then they realize that it's a crisis.
Caregiving is my passion, and I've done it for like 37 years now. So when I wake up, that's what I want to do.
It's very sacred work to me. It's really a blessing to be of service, truly of service to another human being. That's really undervalued in our society.
The people that stay are the people who you want taking care of you, but they also need to be recognized, they need to be compensated, and they need to be supported. We can't have a healthcare system without these people.
The system needs to change, and that was the gift of COVID, if there was one, is to see how quickly we could change. Let's continue with that and really let us adapt for our communities and then study it. Find the best practices and share them, but we have to do it differently to make it work.
We still have a long ways to go. The tunnel is long, but I can see the light. So we're going to get there.
Okay. So when we were planning this event, we weren't sure exactly how to get the true essence of what goes on in the home, the support of the caregivers, that relationship. And we're thrilled with the work that Rebecca Rideout, our videographer, has done to create this amazing video, which truly does speak to the essence of our work. So the question has come up, and I want to let you all know that this video will be available to anyone who is interested. It is our goal to get the word out wherever we can, so we encourage you to share it with other audiences. Diane, do you want to see if there are messages in the chat?
Yeah, there are a couple of people who, again, speak to how this messages within the video spoke to them, thinking that the video is amazing, really want to look for other ways to be able to share the video. So again, as we go through our morning, if there are other comments that you want to share or questions you want to add to the chat, please do, and we will continue to monitor those and share them as we can. It's my privilege now to be able to introduce one of the visionaries that I've had the opportunity to work with, and that's Rachel Brody, who is the medical director of the Pioneer Valley Hospice and Palliative Care. She was featured in the video and is one of our board members. So welcome, Rachel.
Thank you, Diane, for those kind words. It's really a pleasure to be here. Thank you, everybody, for joining us. I will say that I'm also associate faculty at Ariadne Labs, which is a joint innovation lab between the Harvard School of Public Health and Brigham and Women's Hospital. And in all of my work, I feel like my whole career has been about how to really put quality of life at the center of care for older adults. And I joined LifePath and the board of LifePath because it's so clear to me throughout all of my work that what really matters and what really determines clinical outcomes is what's happening in people's daily lives, what's happening at home. It's not what I'm doing in the office or in the hospital, but it's what's happening at home and how the caregivers are supported so they can do the work that they do. clearly there's a staffing crisis that we are all talking about. As a hospice medical director, I'll just say quickly, we have people who are on a 6-month waiting list to get help in the home. Hospice, their prognosis is 6 months. So it basically means that we're not going to be able to provide the help they need. We're not able to get people into long-term care when they need more care if they don't have family around. We're not able to get people into rehab for respite so the family can have a break or go out of town for a wedding. It's just to say, it's very real and it's affecting people's lives every day. The other piece in the video that I just want to emphasize is that I think it's really time for us to recognize that the home care that is being provided and the personal care is really skilled care. And that's what we're talking about, is how to recognize that these are skills and this is highly valuable care for us in the healthcare system. Part of my work at LifePath that's been really exciting and the innovative piece, and we were talking about what's happened during COVID, is we're working on all the things that we think make care better in a community. The one is trying to do an innovative program around complex care management and care coordination, and really thinking creatively with a small group about how to do it better so that we could then share it more broadly if it works with a small group first. You may hear later about adult day health, that there currently are no adult day health programs in Franklin County, working on trying to create one that works for the community. So co-creating with the community what people need and what's going to be effective for them. Also working about improving care between medical providers and LifePath care providers, what's happening on the home care side and the social determinant side to make sure care is coordinated better. But again, also thinking about how do we create the jobs that people want to stay in. So really privileged to be here. Great appreciation to LifePath for inviting me, and I'm happy to answer any questions later as they come up.
Thank you, Rachel, for your participation in the video, your participation with LifePath, and your continued work to find that bridge between healthcare and home and community-based care. I'd now like to introduce Sue Pratt, who is the Executive Director of the Care Coordinate. She has dedicated her professional life to long-term care services, providing direct care herself, to being an administrator and to being the owner of a provider agency. She's basically done it all. I so value our long-standing relationship, both with Sue personally, as well as her relationship with LifePath. She is passionate about supporting the workforce through training, education, and advocacy, and truly understands the plight that is created by the low pay, the job insecurity, and the challenges that these dedicated workers face daily. In response to that, she created Giving Circle, which is a thrift shop that provides quality clothing, housewares, toys, and more to help support our community, as well as the direct service workforce. And the Care Collaborative also provides massage therapy to direct service staff. So without further ado, Sue, I turn it over to you.
Thank you, Barbara. Thank you for this event. Throughout the video, we heard about people wanting to stay in their home, and of course they do. But many elders in our community will need time in a nursing home, maybe long-term or short-term. So I would just like to say that we also need to work on making nursing homes a more home-like environment and investing more of our energy into creating a more visible model of facility care. We're sharing a workforce, home care, nursing home, hospital, adult day health, assisted living. The direct care workforce is dwindling, and we know that. And I think one of the reasons, as well as the fact that it's hard work, it's stressful work, it's very meaningful and rewarding work. But also, I think we need to address briefly here the need for training standards to be improved. Massachusetts is just one of a handful of states in the country that hasn't updated the training standards since 1989 when they came into place. We require 75 hours of training. for a nursing assistant, or a home health aide, 60 hours of training in Massachusetts for a personal care homemaker, and no training at all for a PCA. We call it a consumer-directed program, which means that the consumer gets to direct their care, but I would advocate strongly for training for these PCAs who enter the home of an individual who may have very complex needs and in fact are allowed to do more to provide medication assistance, maybe assistance with other medical appliances, again, without training and without support. So I would love to see that addressed. These workers in this direct care workforce right now are assisting people with multiple chronic conditions. People are living longer and they are living with a variety of conditions. So I think the training could be enhanced to include more knowledge about the body systems, how they work, how we age, what it means to become frail, what is multi-system frailty, and to embrace the dependency that comes with aging. That's the true blessing of this work, is to be able to be assistive to a person who is no longer able to provide for themselves all of their needs. So I think that the state could assist us in legislative ways in making it a little easier for people to get the training, for to maybe be able to modularize the training so people can take the training that they need. Maybe you're caring for a family member and you could also use some training, but you don't need to take a 100-hour training or a 75-hour training and become certified. Maybe you just need to learn how to manage diabetes or reposition a person. So we are creating such a facility, the Caregiver Institute. However, we've waited now for more than a few months just to get through the review process, to start the process of applying to DPH. And I think we could use some help with that. I think what we're doing, I think we always need to thank our caregivers. If you see someone in scrubs in the grocery store or at the gas station, just thank them for their service. Thanks.
Thank you, Sue, for your insights, for your innovative training modules, for acknowledging the vital role that nursing facilities play in the continuum of care and for the challenges that they face. I'll now turn it over to Elaine Flewitt, who is the CEO for Care Central, which is a visiting nurse association, a hospice, and she also offers adult day health programs. And she too has dedicated her life to long-term care support services, and we enjoy a long-standing relationship with Care Central.
Thank you, Barbara, and thank you to all the LifePath staff who for organizing this event and inviting me to speak. I had a nice opening from Rachel, who I think it was in the video, she might have said we need to get the best practice to deal with this workforce shortage. And I get the privilege of talking a little bit about adult daycare, which I think is one of the best practices to be able to care and support our elders and disabled individuals to stay in their home. At Care Central, which was previously GVNA, we had been providing 4 adult daycare centers. Just to give you a little background, in 1997, at the request of Franklin County Home Care, now LifePath, we were able to continue with an adult daycare in Greenfield that was going to close. Seemed to be the right thing to do. We were passionate about this model of being able to care for elders in a congregate setting to keep them in their homes. And the program is small. We moved it. It was small, and one of the challenges that it presents as a small program is the financial viability. But we supported that through the years since then. Prior to the pandemic, Care Central had 4 adult daycares, one in Gardner, Greenfield, Athol, and Fitchburg. We are forced and were forced to close Greenfield, Athol, and Fitchburg and have reopened Gardner. But this is the result of inadequate reimbursement rates. Prior to the pandemic, Care Central really took care of the business, but of supporting it. But then when the pandemic hit, with all the added costs of personnel and supplies and transportation and a decrease in attendance, there was a serious shortage. When we explored reopening Greenfield, we had no transportation options. It's very expensive, but I'm here to say that it's very important that we figure out how to provide this care in the community. We saw the positive effects when we reopened Gardner. Individuals who had been isolated were thrilled to be able to be in a safe environment. When they're at adult daycare, they receive nursing care, activities, 2 meals a day, and a snack. That sustains them greatly to prevent that emergency room experience and hospitalization. So we're really putting a lot of effort into preventive care. And we've done quality projects through the years to document that we were able to prevent those hospitalizations. So it's really an important and cost-effective model going forward to really continue to support elders in the community. It comes at a price. Care Central has great success recruiting staff to work in adult daycare for a few reasons. One, we've been very committed to paying a good wage and benefits. And two, it's a marvelous environment to work in. To see the experiences of people blossoming, whether they had lost weight when they were living home alone, they've gained weight. They are able to interact and really improve their health. And that's very hard to measure, but we've seen it. So I can relate to this really serious workforce environment because through our home care and hospice, as Rachel has mentioned, we are really short on staff. We are not able to provide for all the elders that could provide that could benefit from that care. But in a congregate setting, we can meet more needs, and it's a lovely environment. So we need to figure that out. Very concerned that the state, there were some added dollars initially, but that's going to go away. It's not going to make it any better for other centers to reopen and to provide the care that's needed. And I just have to put a plug in that we really have to figure out the priorities. I'm so thrilled with the legislators that are here today because obviously they do have a sense of the priorities that are needed, and our elders deserve the best. And I am so vested in that and hope to answer any questions down the road. So thank you again for having me to speak about adult daycare, a marvelous, cost-effective way to support our elders in the community.
Thank you, Elaine. Adult day health certainly is a vital service, and we now have no programs in our area. The 2 programs we had were through GBNA in Greenfield and Athol, and that void is painfully felt by both caregivers as well as consumers. Not to have that alternative, a place to go for the day to get the socialization, the support, the healthcare, the medical care, the hands-on assistance is just a terrible loss. I have visited the centers, and the energy, the sense of belonging, the community that is formed in adult day is like no other program that's offered. So I too appeal to the legislators and to all of us to do what we can to create some new models that are sustainable, which do require additional funds. So thank you, Elaine, for your dedication and your work in this field.
Oh, my pleasure. Wish we could do more. Wish we could have continued.
I'm now going to introduce Lisa Gugoni, who is the Executive Director of Mass Home Care, which is our trade association representing the Aging Service Access Points and area agencies on aging. Lisa previously had been the Executive Director for the Home Care Aid Council. She too has spent her career dedicated to advocacy for the workforce and home and community-based services. So, Lisa.
Thank you, Barbara, for the introduction. And I'm so pleased to be here with so many friends and colleagues, people I've known for many, many years. And thank you to the legislators who are on the call. We know all this work could not be done without the dedication of both the federal funders and our state partners. So thank you so much. And I guess, so much I could talk about today, but I do want to say that we are definitely, I think, in an amazing moment for long-term care in our nation, home and community-based services. President Biden and the Congress, and thank you, Representative McGovern. I mean, people are finally focused on home care. They haven't been focused in this space in a very long time. I think the recognition of the workforce crisis in home care, long-term care, adult day health is front and center. And it's such an opportunity. And we're so grateful to the Biden administration for so many investments. Most recently, the American Rescue Plan, which really has provided states with a lot of funding. And fortunately, we live in Massachusetts, where our administration and our legislature are also committed to using those funds to address the workforce crisis we're facing. Now the hard work begins. We have the money and we have to work all together to put the best ideas forward to make the difference. I think a lot of the funding that has been received thus far from the federal government has been focused on what was described earlier as rate add-ons to support people during the COVID crisis. So one-time add-ons to really help people get through this time, which is certainly so important. But I think moving forward, what we need to work with the legislature on is how do we address the rate inadequacy? Elaine just talked about the ADH rate inadequacy. We know in home care, there's, the rates aren't adequate. How do we really address the rates and make them high enough so that they allow the agencies and the organizations to pay these direct care workers a living wage? So I think it's really the next step. And I know the administration is thinking about these things. I know the legislature is thinking about these things. And so I really want to continue to work with all of you and get ideas from this group as well. How do we address that rate issue? I do want to flag that in Massachusetts, Senator Jalen and Representative Carmen Gentile have filed two bills, Senate 774 and House 737. I'll send this again to the legislators on the call, but that would actually require the state to look at the rates paid to home care organizations for the direct care workers and assess what is really a fair, adequate rate. Again, we've been doing a lot of add-ons, and we thank the legislature, we thank the administration for those funds. But when they expire, what happens? We need this funding. Things aren't changing. We all know the cost of living in Massachusetts is so high, and people, cost of everything is so high. These workers cannot continue to work without adequate pay over a long period. It can't just be an add-on. So we really need to talk about that and address that. And again, I know the Baker administration and Elder Affairs, Mary Lou Sutters, and all the legislators are super invested in that. And then in Congress, obviously, we want to thank Congressman Mcgovern for his support for the Build Back Better Act, which is, passed in the House, waiting action in the U.S. Senate. But that would certainly send more money to Massachusetts and other states to support home and community-based services. So again, we thank all the legislators that are really leading the charge. But as the money comes in, we need to figure out how do we work together to use those dollars as fast as we can. The last thing I will say is the Baker administration has proposed in their ARPA plan to CMS to do a call for care campaign to really encourage people to enter this field, the home care field, the adult day health field, the home and community-based field. And that's, I think, really important and something we have talked about for 20 years. And also with those dollars, they're going to invest in training. So again, I'd say same thing. We want to see training change. Sue talked a lot about that. We need to focus on that. So lots of opportunities. The time now is to put those ideas to paper and work with the administration and legislature to put those things in place. So thank you so much for being here.
Thank you, Lisa, for your tremendous legislative advocacy and for keeping all of the ASAPs and AAAs well informed. Before I go any further, I would like to first apologize to Diane Roby for not introducing her. Diane is our Director of Client Services Extraordinaire She oversees most of our client-facing programs and is so well informed about how the struggles within the home care workforce are impacting, again, both consumers as well as caregivers. Diane, are there comments in the chat that you would like to share at this juncture?
Just a couple more about, again, appreciating the video, highlighting the skilled labor force, and a comment about being amazed that Massachusetts is one of only 5 states that does not have updated training standards. So again, I think that this is a wonderful opportunity for people to gain more information and to really help join together to be able to move some of our ideas forward.
Thank you. Okay, so our next segment is to transition to our legislative presentations. We are honored to have Representative Natalie Blais, Senator Joe Comerford, Congressman Jim McGovern, and Representative Susanna Whips with us. And so we will be going in alphabetical order today. So Representative Natalie Blais, I turn the floor over to you.
Oh, it's wonderful having a last name that starts with B. It's so good to be here with you this morning. Barbara and your team at LifePath, thank you so very much for bringing us together. It's good to see my colleagues and so many of you from across the region and across the state who are dedicated to this mission. And a couple of people have posted some comments in the chat about the video and what's been said. And I just want to recognize a number of times that the word home was mentioned. That word means so much, and the importance of that safe space and how we can support our constituents who want to remain in those comforting spaces for their lives. I also want to recognize something that was said in the video and something that Sue Pratt really highlighted, that healthcare workers feel invisible. And I want to be really, really clear that we see you, we feel your passion for this work, we value you, and I want to take this opportunity to thank you for caring for so many residents of our communities in such an incredible, heartfelt way. And I hope you know how much that means, certainly to me. And I just wanted to say thank you and recognize your excellent work there. I've certainly learned a lot here today in the short time that we've been together, and I have a checklist of things to follow up with you on, including the Caregiver Institute, this incredible idea about training modules, the fact that 5 states have not updated, or one of 5 states that has not updated these standards. This is all important work that we as legislators can undertake in partnership with you. So those are some of the things on my checklist. Elaine, you mentioned preventative care and how important that is. That is something I think that we can all be supportive of and be more supportive of. You mentioned our elders do deserve the best. They do. And you are serving them so well every single day. I'm just grateful for your efforts. There's another thing on my checklist here, the fact that we have no adult daycare programs here in the region. That's certainly something that I want to follow up on as well. And Lisa from Mass Home, thank you for your advocacy. Thanks for bringing H737 to my attention in this call. While we were here, I signed on as a co-sponsor, so thank you for that. That is the importance of calls like this, because there are over 4,000 bills introduced in the House. And so I just want to give a shout out to your advocacy and how important that is in terms of moving that important legislation forward. Lisa mentioned some of the funding that's coming out of the state level from the funds that are coming in from the federal government. I just wanted to bring 2 things to your attention that are included in the conference package. So this is the $4 billion ARPA package that the legislature passed. It's currently before the governor for consideration. One of them is a directs the Health Policy Commission to study and issue a report on the state of the healthcare workforce in the Commonwealth. I'm going to put some more details in the chat so that you can see exactly what that report shall include. I'm going to see how good my multitasking is here. So I'm popping that in there so that you can see it. The other thing, among many, many other pieces that are included in that legislation, is $30 million for a reserve to support loan repayment, retention, recruitment programs for human service workers in the Commonwealth. That's a $16.5 million program for loan repayment assistance for home healthcare workers. And then there's also $13.5 million for a grant program for home-based health service agencies to support the retention and recruitment of human service workers. That's great if we can get people into this field, but if we don't address the rate challenges that we're talking about to keep them in this field, we haven't done all of our work there. So I just wanted to mention those couple of things, say thank you again for having us here today, and I look forward to working with you going forward. Thank you.
Thank you, Representative Place, for your heartfelt sentiments, your support of the workforce and the work that we do. We look forward to working with you further on these matters. Okay, next we'll hear from Senator Joe Comerford.
I'm the C. So BC, I'm so deeply grateful to be here. This is actually one of the best legislative events, briefings that I've been to in my 3 years in the Senate. It's hitting all the right lists of things to do, as Rep. Blais said. So Lisa, I signed on to S774 during this briefing. I also didn't know about the bill. And again, this is exactly why we need to come together. And we need your leadership, which you give us in such beautiful ways. I'm not going to duplicate what Rep. Blais, Natalie's great briefing was. I'll add to that just to say another piece of the ARPA bill was this one-time $500 million of investment in bonuses for critical frontline workers. That's not what's needed in terms of sustained respect and dignity for this critical workforce. And I join my colleagues in just being so deeply grateful for the work, but it is a measure of, I think, the legislature trying to say, we see you, we see that you were keeping people alive, frankly, when this pandemic hit, and we're thankful for you. And again, I agree that the other provisions that Natalie mentioned are critically necessary in the bill. I'll just mention a couple of bills that I have that actually have been inspired by people on this call. One is an act allowing spouses to serve as caregivers. As folks know, under mass health regulations for PCA or personal care assistance, care can be provided by sons or daughters, grandsons, but not a spouse. And I've heard from many of you that this is a critical shortfall. And when I think about elder economic security in Massachusetts being at the bottom of the nation, this is a critical piece to be able to both remunerate caregivers from the people who are closest to those who need the care and shore up folks to be able to help them live with dignity in their home if that's what they choose. Another piece, another bill that actually is having some good momentum I'm hopeful about is an act supporting equal access to community care for elders and the disabled. Again, this is inspired by many of you. This is simply addressing a cliff effect issue where if you make just $1 above what is considered the premium, you either have to spend down your income to a ridiculously low $542 or you have to receive care in a nursing home. And I'm grateful for that. I have the House champion there is Rep. Natalie Higgins, and she is totally tenacious. And I'm hopeful that we'll be able to make some gains on this. And that's, of course, the PACE program and the home and community-based services waiver programs. And then the last thing I'll just say is, one of the areas that I do think the legislature also focused on in the ARPA bill was the strengthening of local public health. And local public health as an ally to the frontline providers in programs like LifePath in nursing and other care programs, day programs. It is something that I see Phoebe Walker on the call. Phoebe Walker has been my teacher in this and so much else with regard to local public health. We've made some gains, so we were able to invest $200 million in this sector. We have to make a great many more gains, including more money and authorizing legislation that would help structure some consistent standards, some right-sized and right nuanced data collection, and then frankly, another intersection with the workforce training. You know, that we need to build the capacity of the great people on the front line to be able to do the kind of work that folks need and deserve. So I'll stop here, just mindful of time, deeply grateful to all of you for your critical work, and so glad to join my great colleagues.
Thank you, Senator Comerford, for your tremendous support of LifePath, of the work that is done by our organization and our sister organizations. Your sponsorship of the spouses caregivers is so critical, especially at this time with the diminished workforce. And we've come a long way over the years to allow other family members to get paid, and to omit the spouses is just heartbreaking when so many of them are really on the edge financially and having to make those choices about feeding their family or providing care to their loved ones. So thank you for that. And the equal access to care, the cliff effect is one that, again, brings pain and suffering to people because of finances that really need to be rectified. So thank you, thank you, thank you. I will now turn it over to Congressman Mcgovern.
Thank you. Happy to be with everybody. First, let me apologize for my appearance. I look like I'm an extra in a Rocky movie, but I had a little minor surgery that found a basal, what do they call them? Basal cell, I forgot. Anyway, a cancerous group of cells on my below my eye. Most common form of skin cancer. So I went and got checked and taken care of, and they got rid of it. I probably should have asked questions before they cut it out, because this has like been the busiest week in Congress, and I thought it was just going to be a little quick in and out. But 25 stitches later, and my son says I look better than I've ever looked. So, but it's a reminder that we all need to take care of ourselves, to get regular checkups. Because early detection is everything. Anyway, I'm thrilled, Barbara, thank you. And I'm thrilled to be here with Joe and Natalie and Susanna, who do an incredible job in the state legislature. Admire all their work. We work as a team. They care deeply about these issues. And so it's great to be with them. I'm a big fan of LifePath. I'm a big fan of everybody on this call. I've worked with many of you on a number of issues. Thank you for your work. I appreciate these legislative gatherings because it reminds us that we need to get our act together at the state and at the national level. We need to get our priorities in the right order. We all say that we care deeply about our children. Nothing is more important. We care deeply about our senior citizens. We want to honor them for all their contributions. And yet we pay child care workers and we pay people, home care workers, insufficient salary for the work that they're doing. And we need to get that right. I think it's Lisa, I've worked with Lisa on a bunch of stuff over the years, but I mean, we've been working on trying to get reimbursement straightened out at the federal level for a lot of our home care workers for a long time. CMS is my least favorite agency in the whole world. It's frustrating, but the bottom line is we need to get this right. And while it took a pandemic to get us to at least provide some temporary help to a lot of the work that everybody on this call is engaged in, the fact of the matter is there was a problem before the pandemic. The pandemic just shined a brighter light on the disparities and on the challenges. So we need to get this right. We passed the Build Back Better bill in the House, and that includes $1 billion to strengthen the direct care workforce. So additional funding, once the Senate passes the bill, will help subsidize home and community-based care. And I think that will be another kind of important addition to being able to address some of the challenges that we have faced, that are being faced in our community. We passed a major infrastructure bill that actually is law, and money is going to the state, and it may help address some of the transportation challenges that are faced in our region. One of the, if you live in a city, it's easier to get to and from places. It's easier to try to figure out how to get people to and from places. When you're in more rural communities, it is a bigger challenge. So we need to invest more in public transportation and other forms of transportation to help kind of alleviate some of the challenges that many people face in getting to and from work and to and from people's homes. So look, there's a lot of federal investment that is already on the way. The American Rescue Act provided a great deal of money, but there's a lot of federal investment coming to the state. Some of it is directly aimed at some of the concerns that you have raised, but some of it will allow the state to not have to find the money for some of these things, which means there's more money freed up to be able to reorient in other directions. And we need to be agile and creative to try to help, make those adjustments. And the final thing I'm going to say is I have visited many of the activities that people on this call are involved with. I've gone on home care visits, and I've been to adult daycare centers, and I really lament the fact that we don't have one in the area in Greenfield that's no longer there. We got to figure that out. But the work that is being done here is essential. It was essential not just during the pandemic. It's always been essential. And like Natalie said, we are grateful for all the work that is being done in our community. One of the things that I'm hoping we could try to do in Congress is fix our immigration laws a little bit, so it might help provide more of a workforce pool to be able to dip into, because I think in every field right now there's a workforce shortage, and we need to figure out how to address that. But I want to be wind at your back. Anything you need, call me. You are all fabulous. You're all wonderful. I look forward to seeing everybody in person. If you want me to go anywhere, I will. If I'm not on a bill, I co-sponsored the bills that Natalie and Joe just said they're going to co-sponsor, but I'm not in the state legislature, so it wouldn't do you any good. But if there's anything on the federal level that I haven't done that I need to do, call me. I'll do it. But I'm happy to be with all of you. You all look fabulous on my Hollywood Squares screen here. I don't look so good, but you all look wonderful, and hope to see you soon. So thank you for having me.
Thank you, Congressman Mcgovern, for all of your federal support of our programs. I recall meeting with you a couple of times in your aid to deal with some challenges that we and our sister agencies were having with the Social Security Administration. And we just really know that you do have our back and that we can call upon you. So thank you for that.
Thank
and
you.
Without further ado, I'm going to turn it over to Representative Whips. I'm sorry that you are the W. And
I appreciate being the W. I used to be an L, and that was not a good time in my life. So happy to be a W now. I've been taking notes throughout this whole thing. Of course, I will co-sponsor the bills that you mentioned. When you talked about a 6-month wait list for hospice services, I've been sitting here thinking about just the priceless gift that was given to our family by GVNA Health Hospice when both of my parents needed that service. We couldn't have waited 6 months. having somebody come in the house and give us confidence that we could take care of mom and dad when they were ill was, again, an opportunity that allowed my parents what they wanted, which was staying in their home, and brought our family together and brought me and my siblings together to participate in that care. So I'm so grateful for the services. I've been really concerned recently about mental health of our seniors as they're home, especially throughout COVID. You know, and I'm preaching to the choir when I talk about isolation leading to poor sleeping habits, poor eating habits, lack of mental activity, and all of those things are just so vital. And as we talk about making sure that, I mean, nobody should be working 60, 70 hours a week and not making a livable wage. We have to make sure that the folks who are putting this effort in to really ease the burden on families across the Commonwealth, we've got to make sure that this one-time money can be kind of parlayed into something that's more sustainable for the folks who are there. And then, you know, let's talk about the boomers. People born between 1946 and 1962, that baby boomer generation, we are like right at the beginning of the silver tsunami. And all of these folks are coming in. It's not going to be less services needed in the upcoming years. There's going to be more and more folks who need these services. And I think it's really important that we stay on top of it. And again, organizations like all of you here that are doing these daily welfare checks on our loved ones across the Commonwealth, and especially this region, we appreciate you so much. And anything we can do to help you and help people age in place, because that's kind of the mentality of folks out here. And we have to look at it holistically, as they're not a segment of the community. They are our community, and we can't be splitting them out. And we also have a huge number of women and men my age who are caring for grandchildren and caring for aging parents. And they've got this pressure coming from both the top and the bottom. And we have to look at ways that we can do everything we can to support our families, keep everybody healthy. And again, I'm going to continue to focus on the mental health front, which is something I think is oftentimes overlooked. And I appreciate my colleagues and all of the work they do. And again, a big thank you to everybody who's doing God's work, in my opinion. I appreciate you all. Thank you.
Many thanks, Representative Whips. Thank you for sharing your personal story, as well as bringing attention to the mental health and behavioral health needs of those we serve, which has, you know, was anxiety and depression was at epidemic levels prior to the pandemic, and it's been a devastating situation and continues to be one. So thank you for that. Sadly, it is 10 o'clock. There are lots of comments in the chat that we don't have time to share. We want to stay true to the 1 hour. So what we will do is we will follow up with sending you the transcript of the chat, as well as access to the video. And I will leave you with a challenge. I ask that each one of us here today think about one way, just one way, in which you might be a part of the solution. So thank you, everyone, for your thoughtfulness, for your commitment, and we certainly need to do this more often. So thank you.